Dr. Marc Darrow here again for the second half hour of Living Pain Free. We're going to teach you how you can heal your musculoskeletal pain by just using simple injections with regenerative medicine, which is something I've been doing for, I think it's 27 years, maybe going on 28. I was trained in my residency at UCLA, and I taught there after my residency for 20 years on regenerative medicine. And I think it's been a good life work, training people how to do things that are natural in medicine, how to help people to save them from getting surgery. And I'd love to get some callers. It's always wonderful to have callers on the show. I have a lot of questions from my website. I get questions all day long. And you can go to the website, which is www.stemcellinstitute.com. And every page has a spot to email me. Or you can just call the office and get a free phone consult with my staff. And we'll get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's a book with 200 studies or so on how stem cells and platelets can actually heal the body. Actually, I'm looking at the book right now. It's how many studies is this? It's a huge number. 164 studies. I'm sorry. I overemphasized. It took me about 5 years to write this, to get all the research together. And the book is a couple hundred pages long. We're going to send it to you for free if you call to talk to me live right now at 866-870-5752. You can call me and talk to me and ask about your orthopedic musculoskeletal issues. That's 866-870-5752. I would love to talk to you. So the show is all about how to save yourself from getting needless surgeries. We see people every single day that come in who have had surgeries that have failed, which is unfortunate. I love the surgeons. I don't like all the surgeries they are doing, unfortunately. And at some point, my projection is that, I could be right or wrong. I don't think we'll be doing most of these orthopedic surgeries, from knee meniscal tears, rotator cuff tears of the shoulder, labral tears of the hip, things of that nature. I don't think we're going to be doing those. The studies are replete that most of these surgeries actually fail. Sure, we're going to need orthopedic surgeries for major issues, but for things that are more what I'm going to call on the minor side, which are the things that most people have. Oh, look at this. We got a call coming in from Mac O'Grady, and you can put him on the line as soon as he is ready to speak. Mac, are you there? Hello, Mac. Mac O'Grady, where are you? By the way, I'm going to give a little preface to Mac here. He's a great guy. He is one of the greatest masters of the golf swing that there's ever been. And he is one of my patients, and he lives in Japan, but he flies in for treatment when he's not doing tournaments here. And can you put Mac on? I know his story. There we go. Mac O'Grady, my favorite guy on the whole planet. How are you feeling today?
Good morning, Dr. Darrow. How are you? I'm doing great.
I'm living it up. I know you are too. You're a positive guy. So I understand one of my patients called me last night. He said he saw you at the golf course yesterday.
I was over here at my Galapagos Islands called the Rancho Park Golf Course. It's my home.
Wonderful. Wonderful, wonderful. How's your body been feeling lately? I know you've had issues on and off throughout the years that we've taken care of. I heard that you're getting ready.
A month ago. No, sorry. Go ahead.
I understand you're getting ready for a tournament. Is that right? So you're working out quite a bit?
We are doing that, and I got injected with you a month ago, and I just wanted to call to report that over 30 days have passed, so I'm starting up my regimen to get in good physical shape, and I'm doing all the little therapies and riding the bicycle, stationary bicycle, on the treadmill, and it's all systems go. So thank you very much.
Well, you're welcome. It's always a pleasure, and I love when you come in the office so you can give me some golf tips.
So listen, I
unlike
just
you,
wanted to make
unlike you, I don't get better.
listen, I wanted to share a
If
thought
any,
with you and your audience as well about stem cell injections. I've seen you for well over a decade, and every time I come in, as you know, I take a little bit more time to rev up the engine again and start exercising. I usually wait a month or even longer. But the stem cell injections, and people may not be fully aware of this, but its goal is to repair damaged tissue, whether through disease or injury. And I've had a share of surgeries, and I've beat my body up by just exercising over the decades. And if it wasn't for the stem cell injections that I've received from you, I would really be in a really poor shape physically. So I'm just here to give a simple testimony how much I do believe in the therapy and what you're able to do and help those who really need help.
well, we do what we can, just like what you do with golf in terms of being such an amazing player and teaching other people your special technique. Mac has a swing that is I don't know of anybody on the planet that's as perfect as his swing, and I think most people still today try to emulate it. I know I certainly try. I can't get there, but it's amazing, Mac. I know you've had a lot of injuries over the years because you are, like me, a repetitive athlete, and you keep going after it. And I'm so grateful every time you have come in the office because you're actually like a spiritual inspiration also to be able to do what you do. Yeah. So anytime you want to come in, the phone number to the office is 800-300-9300, and I'd love to see you again. You and I get to talk about, every golfer on the planet, and you were with the guys who got this game famous years ago, and you're one of them that helped do it. So God bless you, man. We really appreciate the work you do in golf.
Well, thank you.
Listen, I'll talk to you soon.
You got it. Bye-bye, Dr. Darrow. Bye-bye.
All right. God bless you.
Bye-bye.
Now, that man is one of my favorite people on the planet. And he actually offered me a free lesson one time. So I went out to meet him at the course, and he spent 8 hours with me teaching me. And he is such a perfectionist, such a good guy, and a real inspiration to athletes all over the world. So I'm going to go to, until we get another caller, I'm going to go to take some questions that come in. This one is on PCL/meniscus. PCL is the posterior cruciate ligament. We hear all the time about the ACL, which is the anterior, meaning the one in front of the knee that holds the tibia to the femur. And this one is about the PCL. So let's see what this person has to say. Right knee torn PCL, May 2025. Ooh, with a broken fibula at the PCL attachment, also torn meniscus. So this person doesn't have a lot more information about what's going on. The injury was about a year ago, and that knee is probably pretty much healed up by now, hopefully, other than there's still pain. I'm assuming that. And we treat these all the time. It's very easy to help get knees like this, even though they have what I'm going to say are horrible diagnoses and look like they should have surgery just because of the diagnosis. We find that they really don't need to. We look with an ultrasound, we see what the pathology really is, rather than what doctors say it is or what images say it is, and we find out where the pain generator is, and then we can inject in that exact spot. So the things we would look for when this gentleman comes in is there, where is the pain? Because that's primary. We got to get rid of the pain to get a person back in their sport. Is there instability? There's a test we can do that we can push the tibia backwards and see if it moves backwards against the femur. If it's loose, that person may need surgery, okay? Most of these are not loose. They may show a tear on an MRI, but we have to be careful because MRIs can be overly sensitive. That means they have what are called false positives. They show things that are not really there. And many times I've had patients who didn't listen to me, who went out and got a surgery, and then when the surgeon went in, let's say for an ACL ligament tear, the surgeon said, I don't understand it, it's not torn. The MRI showed that it was torn, but it wasn't. So they patch them back up again. Why is that? The MRI is magnetic resonance. It's not an actual photograph. It's different slices of magnetic resonance, and it's a little bit fuzzy, so it can show things that are not really there. So be very careful if you have a diagnosis from an image, and that can even be, let's say, an X-ray. We have people that come in and an X-ray shows that their hip has arthritis. Their doctor says they need a hip replacement, let's say, or a knee replacement. We move the joint and we tell them they don't need a replacement because the joint is working fine and that arthritis is not really causing their problem. So there's a lot of confusion in medicine about, and in orthopedics, about what really is the pain generator. And I've had patients come in with more pain in one side of the body where there is horrible arthritis, and the other side where there's very little, if any, where the surgeon says they want to operate on that because there's arthritis there and there's pain, whereas the other side didn't have pain. You can have arthritis and have no pain, and vice versa. Got to be very, very careful. It's unfortunate that our system is driven by surgery. I'm not blaming the surgeons. I love orthopedic surgeons. I think they do the most difficult work in medicine. And unfortunately, there's a lot of bad outcomes, which we see. Because when a surgery fails, that's when a person often comes to us. So we have to be very, very, very careful about if we're going to do a surgery, whether we really need it or not. I know that the younger population in school, they love getting surgeries because their friends had them. It's like the red badge of courage, but I think it's a very horrible thing. Once there's a surgery and tissue is taken out, that joint is destabilized for the rest of that person's life. And the next time they tweak that body part, there's another surgery and then maybe a joint replacement. And those are no fun. Those are just no fun at all. So if you call the office or call the studio right now, I'm going to give out the studio phone number. We're going to send you out a free copy of my book, Stem Cell and Platelet Therapy. Regenerate, don't operate. That means we can actually grow back the tissue like that golfer who just called, Mac O'Grady, was discussing. And the number to the studio right now to talk to me live, you can ask me anything about musculoskeletal medicine, orthopedics. That's 866-870-5752. That's 866-870-5752. Give me a call right now. See if you have a question that I don't have an answer to. I'll tell you if I don't have the answer, and I'll do my homework and try to find the answer and get back to you. You can also ask questions on the website. If you're shy, hope you're not shy, but you can ask via email questions on the website, which is www.stemcellinstitute.com. So I'm going to go to another question. This one is on muscle aches. That's a little unusual, but it happens. This person says, I have no bone-related issues, only muscle aches. Am I a candidate? That's a dicey question to ask over the internet or on the radio, because until I touch the area to find out what's really going on, we don't really know what's going on, okay? So I don't diagnose based on what people tell me or what other doctors say. I do it based on what I find using my hand. Can the muscle aches be related to a joint injury, to a tendon injury? what is the actual issue? Is it an enthesopathy? That's a big word, but it's a simple concept. The enthesis is where the muscle, tendon, or ligament attaches to bone. And most of the injuries that people have are simple enthesopathies, and stem cells and platelets can be used to heal those very, very simply. So I need to touch the area, find out which muscle it is that is causing the problem. Is this person just stiff? There are certain actual diseases that cause stiffness. One of them is DISH, D-I-S-H. You can look that up. It's an autoimmune type thing. There can be ankylosing spondylitis, and there are other issues that can cause muscle aches all over the body. And we have to actually check the person out. Sometimes we have to get a blood test to see if that person has that specific disease. But even if you have the diseases, stem cells and PRP can help. Okay? You're not locked in to a disease for life that's causing you misery. You may have the disease, but that may not be the cause of your pain. I feel like I'm Sherlock Holmes. I go beneath the diagnosis, I go beneath the images to find out, and I use my hands to find out where the pain is being generated from. It's only way too often the people come in with the wrong diagnosis. So we have to be super, super careful. Don't get a surgery unless you absolutely need one. They have terrible side effects. Anesthesia can do things to people. I've seen people die on the table from anesthesia. These things happen. I'm not saying they happen often, but you don't want to be the one it happens to. Then it's 100% for you. So be very, very careful. Okay, we're going to another question here, and this one is on, wow, this is a good one. I like this. Metatarsophalangeal joint. That's one of the toe joints. Let's see what the person says. Do you treat arthritis in the NTP joint? Yes, we do. If so, what are my treatment options? The best treatment for that is a mixture of your own PRP plus stem cells. It's a teeny little joint, and if any of you are having what we call hypertrophy of that joint, we call it a bunion, and it can be very, very painful. There's a couple things to be done for it. The most conservative, if it's not something horribly arthritic, is to put orthotics in. We can cast the orthotics, takes a minute to do so, and they fit in your shoe. I wear them. I was an avid tennis player when I was younger, pounding the cement all the time, and I started having that in my right MTP joint, and as soon as the podiatrist put an orthotic in my shoe, my foot felt better. I have not had to inject it. But I do, on occasion, inject this joint. We use a 30-gauge needle. It's like a feather. It's so thin. And we can spray ethyl chloride on the area so you don't feel as much pain. We can actually numb things up with numbing cream if you're needle phobic. There are some people that are afraid of needles, and they don't seem to have a problem with us. We use very small needles compared to other doctors, and believe it or not, it makes sense, right? The smaller the needle, the less painful the injection. We've both Dr. Grove and have injected ourselves many times, and we know that using a tiny needle is a lot better option. We have to push harder, which can hurt our hands sometimes, but it's better for the patient, so we do that. So yes, we do treat arthritis in the toe joint, but we treat every joint in the body. We treat the entire body. There's really nowhere we don't treat. We do necks, we do backs, ribs. I just did some ribs yesterday. One of my patients fell down, and he texted me, says, "Can I come right in?" And I said, yes. He came over, and we did his ribs. And after I finished, he said, "By the way, can you do my neck?" And I did that too. So we can really put regenerative medicine cells anywhere in the body if it's appropriate. And that's really the key. Is it appropriate? We heard from, in the beginning of the show, Carla and Ben were being, I'm going to say, hyped to do IV infusions, IVs of stem cells. And as far as I'm concerned, the jury is out on that one. I haven't seen anyone who's come to me ever who said that has worked for them long term. Everybody seems to get a little buzz about it for a few days. They feel better, but no long-term stuff. So I'm not sending any of my patients out to Thailand or Mexico or Costa Rica to get IV infusions of stem cells. I've just never seen results. And I'm just remembering, it just popped into mind, many years ago, before anybody heard about stem cells, I did, and I flew to the Bahamas one time, and I went to the Dominican Republic another time. I did have IV stem cells. I forgot about it. It's been so long ago. But the reason I forgot about it is they did nothing. I got nothing out of it at all. It was an experiment for me. I've always been an innovator in terms of medicine, regenerative medicine, other things, hormone therapy, and the things that actually work for people. I like to do medicine that's natural and medicine that works. I'm not interested in following the herd, of what doctors say should be done, or the AMA says should be done, or the algorithms of medicine. That doesn't impress me at all. I like to do what works, and I know things that work because they work on me. And when something works on me, I'll ask my patients if they want to try it. When I was first starting doing regenerative medicine, when I was at UCLA, I would ask people, I'd say, do you mind if I try this on you? I've tried it on myself, it's helped, and I want to see if it works on you. We can save you potentially from a needless surgery that can hurt you. And that's how I got started doing regenerative medicine. So I feel very fortunate about that. All right, so back question here from the website, which is www.stemcellinstitute.com. You can go there, you can watch videos of me doing these injections, and every page has a spot where you can email me, and I will get back to you that day. And this is a question that came in from the website. It says, I'm healthy, I'm 87 years old, I take no medicine. I was just diagnosed with no cartilage on the right hip. I'm going to bet that's not true. Prior years gone to chiropractic for years for low back issues. An MRI operator person noticed, sorry, this is a good one. I'm sorry the show is over, but if you want to reach our office and talk to our staff and get a free phone consult right now, the phone number to the office is 800-300-9300. That's 800-300-9300. And the website is www.stemcellinstitute.com, where you can email me directly, and I will get back to you that day. God bless you all, and thank you so much. And live pain-free.
You've been listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff absolutely free. And ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to stemcellinstitute.com. Again, the website is stemcellinstitute.com. Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.